due to accumulation of fluid in the patent thyroglossal tract. So thyroid is formed where? Thyroid originates from, important one liner, embryology se, surgery se. Thyroid originates from the foramen cecum. Thyroid originates from foramen cecum is located on junction of the anterior 2/3 and posterior 1/3 of the tongue. Okay, so thyroid originates from the tongue, okay, from the foramen cecum, and then it descends down into the neck via thyroglossal tract. But this thyroglossal tract should obliterate after birth. But if it remains patent, वैसा ही रहता है, then there can be accumulation of fluid and leading to formation of thyroglossal cyst. ठीक है, important. Now please tell me, what is the treatment of choice for thyroglossal cyst? It is a clinical diagnosis. It is a clinical diagnosis. Along with that, if we need to perform anything, then we can do a ultrasound of thyroid. Along with that, we can do a FNAC, just to rule out if it is not any benign or malignant tumor. Okay, just to rule it out. Very good. And the treatment of choice is a surgery known as treatment of choice for thyroglossal cyst is cyst trunk operation or cyst trunk surgery. When we will remove the thyroglossal cyst, we will remove the patent thyroglossal tract and the foramen cecum. Okay, so all of this would be removed. That is what is the cyst trunk surgery. Okay. If thyroglossal cyst is there and we drain it, if we do an incision and drain it, or if this thyroglossal cyst undergoes rupture, then there would be formation of a thyroglossal fistula. याद रखना ये क्वेश्चन था. Thyroglossal fistula is always and always acquired. It is not natural. ठीक है? Thyroglossal fistula is always and always acquired. Either it is after incision and drainage or rupture of thyroglossal cyst के बाद होता है. No issues with this. And the treatment for thyroglossal fistula is also cyst trunk operation. Treatment of thyroglossal fistula is also cyst trunk operation. No issues with this. Very good. Next, if I say, guys, over here also I have a child, okay, and he presents to you with neck swelling again. But this neck swelling appears to be diffuse. This neck swelling appears to be diffuse neck swelling. Okay. So your neck swelling, it is also in the midline as well as it is also on the sides. So this is, along with that, you can see there is protrusion of the tongue. That means the swelling is usually in the floor of the mouth. So if there is a diffuse swelling involving the whole neck and there is some swelling in the floor of mouth, what do you suspect? Very good. You suspect Ludwig's angina. So here the diagnosis would be. So this is a differential diagnosis, guys. Swelling se question important. Okay. So the diagnosis would be Ludwig's angina, and Ludwig's angina is due to infection of the floor of mouth. Ludwig's angina is due to infection of the floor of mouth. There would be accumulation of pus or abscess in the floor of mouth. It is usually after a dental infection. Okay, it follows a dental infection. After a dental infection episode, patient will present to you with diffuse neck swelling along with protrusion of tongue, and there would be infection at the floor of mouth. That is what is Ludwig's angina. Incision and drainage karoge, that's it. Important. Next, if I say my patient presents to me with this kind of a posterolateral neck swelling. Okay. So here you can see it is a posterolateral neck swelling. Posterolateral neck swelling means it is behind the sternocleidomastoid muscle or behind the or in the posterior triangle of the neck. So as posterolateral neck swelling is suggestive of, very good, this is known as cystic hygroma. It is known as cystic hygroma. And cystic hygroma is due to defect in the lymphatic system. Cystic hygroma in the lymphatic system. Okay, if the lymphatic system is not properly formed, then there would be accumulation of lymph in the posterior triangle of neck, and which is called as cystic hygroma. Okay, so कौन सा defect है ये? Lymphatic defect. Which defect is cystic hygroma? Which defect is cystic hygroma? Lymphatic defect, right? And here, if I throw some light on from one side, I will get a brilliantly transillumination from the other side. So transillumination test is positive. Transillumination test is positive in case of cystic hygroma. Okay? Important. No issues with this. Please let me know if you are able to hear me now. Please let me know now. Okay? So please remember, posterolateral neck swelling due to defect in the lymphatic. Trans elimination would be shabash. And cystic hygroma is also a marker of some chromosomal abnormalities or aneuploidy. जैसे कि डाउन सिंड्रोम का मार्कर हो सकता है cystic hygroma in a child. Next, if I say this kind of a patient coming to me, but this time the neck swelling is not posterolateral, rather it is anterolateral. Anterolateral means on the anterior border of the sternocleidomastoid muscle. So anterolateral neck swelling is suggestive of सॉफ्टवेयर से कौन बात है एक बारी कोई कर दो यार. So anterolateral neck swelling की अगर मैं बात करूं, then it is usually a what? Branchial cyst. So anterolateral neck swelling would be a anterolateral neck swelling is a so branchial cyst is due to patency of the pharyngeal pouch. The pharyngeal pouch, that is second and sixth pharyngeal pouch, they are connected and they form the cervical sinus. But this cervical sinus obliterates after birth. अगर वो obliterate नहीं होती, if it remains patent, again there would be accumulation of fluid and there would be formation of branchial cyst. So branchial cyst is due to patent pharyngeal pouch or patent cervical sinus. याद रखो, ठीक है? Branchial cyst is due to patency of branchial cyst is due to patency of cervical sinus. No issues with this. Anterolateral is branchial cyst. Posterolateral is cystic hygroma. Diffuse with floor of mouth is Ludwig's angina. Midline neck swelling is thyroglossal cyst. कोई दिक्कत नहीं है, important है. Next, if I talk about this condition, guys, what is this? This is a thyroid scan. What is this? This is a thyroid scan, and radioactive iodine thyroid scan is done. And for this, we use a radioactive iodine. The radioactive iodine used for diagnostic purposes is iodine 123. For diagnosis, we use iodine. Half-life of iodine 123 is. For diagnosis, we will require a shorter acting one, right? So for diagnosis, iodine 123 is used. And कैसे याद रखना है? 2 बीच का काट दो, so half-life is 30 hours. ठीक है? So what is the half-life of iodine 123? Half-life of iodine 123 is, and for treatment we use iodine. 131. What is the half-life of iodine 131? Half-life of iodine 131 is. For treatment we use. For diagnosis we use. Important. ठीक है? Iodine 125, 127 बहुत सारे यूज कर सकते हो. Commonly used is iodine 123. ठीक है? Iodine 123. Sorry. It emits which rays? Very good. It emits beta rays. It emits which rays? It emits beta rays. So it goes into the thyroid. It is uptaken by the thyroid and it will emit beta rays, which will destroy the thyroid follicles. Okay, and therefore, after radioactive iodine ablation, the patient will require lifelong thyroxine supplementation. After radioactive iodine ablation, the patient will require lifelong thyroxine supplementation. Therefore, it is avoided in younger patient, less than 35-year-old. It is avoided in young patient, less than 35-year-old. So it is done in only old patient. It is done only in old patient, and it is absolutely contraindicated in. Pregnancy. No issues with this. Very good. Now, if I do a thyroid scan, a patient presented to me with a neck swelling. It was a thyroid neck swelling. I palpated it. Okay, I palpated the neck swelling, and I found that there is a thyroid gland enlargement. And thyroid gland enlargement is called as. Very good. Thyroid gland enlargement is called as goiter. Thyroid gland enlargement is called as goiter. So goiter is nothing but enlargement of your thyroid gland. Most common cause of goiter, anybody? Very good. Most common cause of goiter is iodine deficiency. And iodine deficiency की वजह से जो goiter होता है, it is called as endemic goiter. Which is also the most common cause for hypothyroidism. Endemic goiter is the most common cause for hypothyroidism, right? In India, it is Hashimoto's thyroiditis. Worldwide, it is endemic goiter. कोई दिक्कत नहीं है. Then if I perform a thyroid scan for this neck swelling, and if I found a decreased uptake in particular area, okay, decreased uptake in particular area is known as a cold nodule. Decreased uptake is known as a and cold nodule is highly suggestive of a malignancy. Cold nodule is highly suggestive of a if I found increased uptake, okay, increased uptake in a specific area, it is suggestive of a hot nodule. Hot nodule can also be suggestive of malignancy, but only 4% cases. Cold nodule, it is more than 20% cases. Okay? Then if I say there is a diffuse increased uptake in iodine, then it is suggestive of Graves' disease. Okay, if there is diffuse increased uptake in iodine, it is suggestive of Graves' disease, and Graves' disease is the most common cause for hyperthyroidism. No issues with this. If I see some cold nodules and some hot nodules, then it is suggestive of toxic multinodular goiter. If it is hot nodules plus cold nodules, it is suggestive of toxic multinodular goiter. Hot plus cold, toxic multinodular goiter. No issues with this. And if there is a decreased uptake, throughout the gland, it is suggestive of thyroiditis. And lymphocytic thyroiditis, which is the most common cause of hypothyroidism in India, is known as Hashimoto's thyroiditis. No issues with this, anybody? Okay. Then if I say a patient was having enlargement of the thyroid gland, but I was able to palpate the upper lobe, but I was not able to palpate the lower limit. If I am not able to palpate the lower limit, that means the thyroid is enlarged behind the sternum. Therefore, I am not able to appreciate the lower limit. Okay? I was able to appreciate the upper limit, but not the lower limit. So this is what is called as the retrosternal goiter. Okay? Retrosternal goiter means enlargement of the thyroid gland behind the sternum. And here you will not be able to appreciate the lower limit of the thyroid. कोई दिक्कत नहीं है. Now, if there is retrosternal goiter in a patient, definitely the patient can have pressure symptoms. Okay, there would be dysphagia in the patient, inability to swallow. There would be noisy breathing, which is called as stridor. If it will compress trachea, there would be stridor in the patient, right? Inspiratory stridor, yeah. Lower respiratory tract, it is inspiratory stridor would be there. There would be dysphagia in the patient. Okay? So all of these pressure symptoms would be noted. Along with that, you can perform a test. Okay, you can ask the patient to raise his hand above the head level, and when he raises his hand above the head level, then there would be facial congestion. Or facial plethora. Okay? This is what is called as which test? Right. This is called as the Pemberton's test. And Pemberton's test is positive in. No issues with this. याद रखना image आ चुकी है for Pemberton. Okay. Now please tell me what is the treatment of goiter? Definitely thyroidectomy. It is thyroidectomy. For retrosternal goiter, please tell me thyroidectomy would be performed from the cervical approach or from the sternal approach? So mainly it is done from the cervical approach. ठीक है? Sternotomy is rarely required. Don't mark it as sternotomy. This was a question. Okay? A patient is having a retrosternal goiter. What is to be done? Okay, the surgery is done from the neck itself. Okay, the incision is to be given in the neck, not in the sternum. Okay? Unless and until you cannot resect it properly. Then if I talk about thyroid cancer, guys. Sorry. So thyroid cancer की TNM staging, it is easy to remember. Okay, so नहीं याद रख सकते तो कोई बात नहीं, but at least if you can remember, it is better. So thyroid staging, it is T1, T2, T3, and T4. So T1 means the tumor is less than. T1 means tumor less than. T1 means tumor less than. T2 means tumor between 2 to. T2 means tumor between. T2 means tumor between. T3 means tumor more than. T3 means tumor more than. And T4 means extrathyroidal extension. Okay, T4 means extrathyroidal extension. T4 means extrathyroidal extension. What do we mean by extrathyroidal extension? That means there is involvement of the adjacent structures. So in T1 and T2, the tumor is specifically only located to the thyroid gland. In T1 and T2, the tumor is only limited up to the thyroid gland. In T3, it can be in the thyroid gland or it can also involve the structures, and those are called as your strap muscles of neck. Okay, in T3 there is involvement of which muscle? In T3 there is involvement of which muscle? Okay, so T1 staging batao. T1, 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 T2, T2, T3, T3, T4. No issues with this. Breast की जल्दी से बता दो. T1 less than 2. T2 2 to 5. T2 2 to 5. T3 more than 5. T4A chest wall. T4B, T4C both. T4C both, and T4D inflammatory breast. Shabash. Okay. Now, if a patient is having thyroid cancer, it can be of multiple types. It can be a differentiated thyroid cancer, like a papillary thyroid cancer or a follicular thyroid cancer. Most common thyroid cancer, anybody? Very good. The most common thyroid cancer is papillary thyroid cancer. Papillary thyroid cancer is more common in which age group? It is more common in which age group? It is more common in the 3rd to 4th decade. It is more common in the 3rd to 4th decade. That means it is more common in 20 to 40 years of age group. It is more common in 20 to 40 years of age group. No issues with that. Young patient presenting to you with neck swelling and cancer है, तो कौन सा होगा more commonly? Papillary thyroid cancer. No issues with this. Important risk factors for papillary thyroid cancer. It is associated with radiation exposure. It is associated with radiation exposure. And most important, the second one is family history. तो सब में होगी. It is common in family history, can be over here also over there. साथ के साथ बाकी syndromes के साथ associated है. Main is a history of thyroglossal cysts. History of thyroglossal cysts. So which are the most important risk factors for papillary thyroid cancer? First is, second is. तो याद रखना, if they give classical equation आ चुका है, if they give you a classical case of thyroglossal cyst and ask you the patient is more likely to produce which, the patient is more likely at the risk of which thyroid cancer, answer would be papillary thyroid carcinoma. No issues with this. Then if I ask you about the biopsy picture, so on biopsy I can see two findings. First would be calcified concentric or lamellated rings. Those are called as Samoma bodies. So Samoma bodies are seen in which thyroid cancer? Samoma bodies are a feature of which thyroid cancer? Samoma bodies. PSM, jaldi se. P for papillary thyroid cancer or papillary renal cancer. S for serous cyst adenoma. M for meningioma and mesothelioma. Shabash. Along with Samoma bodies on the biopsy, I will also be able to appreciate these empty nucleus. And the empty nucleus in this malignant cells is actually called as which appearance? So they look like this cartoon, okay, known as Orphan Annie. Okay, they look like the eyes of this cartoon known as Orphan Annie. Therefore, they are known as Orphan Annii nuclei appearance. What would be seen? Orphan Annii nuclei appearance. What is seen? Orphan Annii nuclei appearance. So this came directly in August examination. They give you a classical case of thyroid cancer and they gave you this finding. So uske baad to koi doubt hi nahi bacha. Okay. So two biopsy features of papillary thyroid cancer. First is. Second is Orphan Annii nuclei appearance. No issues with this. Yaad rakhna. Then if there is a metastasis from the papillary thyroid cancer, it can be by direct invasion, lymphatic route or hematogenous route. Mainly it is by the lymphatic route. Okay? So if there is a lymphatic spread of this papillary thyroid cancer, then it is called as, so if there is lymphatic spread from the papillary thyroid cancer to a cervical lymph node, this is called as what? This is called as lateral aberrant thyroid. This is called as lateral aberrant thyroid. So what is lateral aberrant thyroid? Metastasis from papillary thyroid cancer. This was a question. Okay, yaad rakho. What is lateral aberrant thyroid? What is lateral aberrant thyroid? What is lateral aberrant thyroid? Metastasis from papillary thyroid cancer. ठीक है, no issues with this, याद रख लो. Then if I talk about the other differentiated thyroid cancer, okay, sorry, if I talk about the other differentiated thyroid cancer, and that is known as follicular thyroid cancer. That is known as follicular thyroid cancer. So यहाँ पे देख लो thyroid tumors. If they ask you, the most common benign thyroid tumor is okay. If they ask you primary thyroid cancers or primary malignant tumors of thyroid, differentiated are two. Most common is second most common is follicular carcinoma now, not adenoma. ठीक है. Undifferentiated is known as and therefore anaplastic will have the worst prognosis. Anaplastic cancer has the which thyroid cancer has the worst prognosis? The tumor which arises from the parafollicular C cells. So all of these are arising from the thyroid follicles. But if it arises from the parafollicular cells, then it is called as medullary thyroid cancer. If it arises from the parafollicular C cells, it is called as medullary thyroid cancer. Okay? If it arises from the lymphoid cells, it is called as a lymphoma. And thyroid lymphoma is more common in which age group? Thyroid lymphoma is more common in okay, and it is a Hodgkin's or non-Hodgkin's lymphoma. Hodgkin's is only limited to the lymph node. Non-Hodgkin's lymphoma also spreads to the other organs. ठीक है, so lymphoma अगर वो organ में बोल रहे हैं, then it is more likely to be a non-Hodgkin's lymphoma. No issues with this. याद रखो. Then talking about the follicular thyroid cancer, it is more common in which age group? It is more common in 50 to 60 years of age group. That is more than 50 years of age group. It is more common in more than 50 years of age group. So young patients में papillary, young patients में, old patients में, and the most important risk factor would be iodine deficiency. That means I can say it as endemic goiter. So the most common risk factor or most important risk factor for follicular cancer is okay, important. No issues with this. Young में papillary, old में follicular. Thyroglossal cyst के बाद papillary, radiation के बाद papillary, but endemic goiter के बाद follicular. Investigation of choice, anybody? Very good. Investigation of choice would usually be a ultrasound first and followed by a biopsy. Ultrasound guided FNSC. FNSC is a form of biopsy only. Fine needle aspiration cytology. Okay? So FNSC is usually not so much helpful in case of follicular thyroid cancer, because it will not tell you whether it is a follicular adenoma or a follicular carcinoma. Okay? No issues with this. याद रखो. What is the treatment, anybody? If it is a cancer, definitely the treatment would be removal of thyroid. That is what is known as thyroidectomy. The treatment of choice is thyroidectomy. Okay? Removal of the thyroid gland. It can be done if one lobe is removed. It is called as if one lobe is removed. It is called as So I hope all of you are quite aware that thyroid is a butterfly-shaped gland having two lobes connected by a isthmus. Okay? So one lobe is removed. It is called as lobectomy. If one lobe is removed along with isthmus, it is called as hemithyroidectomy. If one lobe is removed along with isthmus, it is called as hemithyroidectomy. Okay? If only 8 grams of tissue is left behind, okay, if 8 grams of tissue is left behind, other thyroid is removed. That means 4 grams on one side, 4 grams on the other side. If 8 grams of tissue is left behind, it is called as subtotal thyroidectomy. If 8 grams of tissue is left behind, it is called as याद रखना 8 grams is left behind. ठीक है? Other everything is removed. Then if I talk about 25 to 30 grams होता है weight thyroid gland का. Total thyroidectomy means both lobes plus isthmus. Total thyroidectomy means both lobes plus isthmus. No issues with this. कभी-कभी वो near total पूछ रहे थे. So near total thyroidectomy is बहुत सारा अलग-अलग डेटा है. Okay, so some books say only it is some of the thyroid tissue is left behind. Some book says only 1 to 2 grams of thyroid tissue is left behind. Some book says 5 grams of tissue is left behind. So you can remember it as 1 to 5 grams of tissue is left behind depending on the involvement. Kitna involvement hai depending on that. Okay. Our target is to leave maximum thyroid tissue behind. Okay. No issues with this, anybody? Next, a patient. Uske pehle ye dekh lo. Now, what is this? Here you can see enlargement of the thyroid gland. Again, it is a goiter. But here you can see there is some enlargement. Okay, there is nodular enlargement of the thyroid. So it very good. It is a multinodular goiter, or sometimes also termed as toxic nodular goiter. So this is what is called as a multinodular goiter. Okay, this is what is called as a multinodular goiter. And as we know, in multinodular goiter, thyroid scan will show which nodule? Both hot as well as cold nodule. Hot as well as cold nodule. Next, this was a question, guys, in the previous exam. A patient underwent a total thyroidectomy surgery and now presents with perioral paresthesia, carpopedal spasm. What is the cause? So definitely it is due to some electrolyte abnormality. ये तो समझ में आ गया. So thyroid gland के पीछे which glands are there? Parathyroid gland. Okay. Behind the thyroid gland there are 4 parathyroid glands or 2 pairs of parathyroid gland. So whenever we perform a total thyroidectomy surgery, what can happen? There would be a accidental removal of the parathyroid gland. There is accidental removal of the parathyroid gland, and parathyroid gland will increase the level of serum calcium. But if parathyroid gland is removed, then there would be hypoparathyroidism, and that will cause hypocalcemia. So if there is hypocalcemia, that is the reason why the patient will present to you with perioral numbness or perioral paresthesias would be there, and carpopedal spasm. That means when you inflate the BP cuff, there would be this kind of a spasm in the hand, and this is known as which sign? Carpopedal spasm is known as which sign? Carpopedal spasm is known as which sign? Carpopedal spasm is known as which sign? It is also known as which hand? ये question था. It is also known as which hand? It is also known as obstetrician's hand. It is also known as which hand? It is also known as which hand? Obstetrician's hand. Okay, so carpopedal spasm is known as which sign? Rosio sign. And which hand? Obstetrician's hand. Okay. So usually hypocalcemia after hypocalcemic features after a total thyroidectomy surgery is usually due to what? It is due to accidental removal of which gland? Parathyroid gland. It is due to accidental removal of. So this was a question. ठीक है, option में ये था accidental removal of parathyroid gland. It is the cause of hypocalcemia post total thyroidectomy surgery. Along with that, if I tap on the facial nerve distribution, the patient will have grimace, and that is what is known as the Chvostek sign. That can also be elicited. Along with that, ENT का एक important question also comes from surgery. After a total thyroidectomy surgery, if the patient presents to you with hoarseness of voice, that means there is injury to the. Very good. That means there is injury to the recurrent laryngeal nerve. No issues with this. So most common nerve injured after total thyroidectomy surgery is the RLN, recurrent laryngeal nerve. Okay, because it is in close relation to the thyroid gland. Inferior or superior? Inferior is the RLN, superior is the SLN. Starting with vascular surgery now. A 57-year-old patient complains of intermittent claudication. What do we mean by intermittent claudication? When the patient starts walking, then there would be pain in the calf. Okay, that is what is called as intermittent claudication, or that is for your lower limb. Or whenever the patient starts writing, then there would be pain in the upper limb. That is what is called as intermittent claudication. Okay, pain on activity is called as intermittent claudication. And now the patient will present to you with pain at even rest. It is usually in the lower limb over a period of last 6 months. Agar last 6 months mein, that means it is a gradual disease. It means a gradual obstruction ho raha hai. What is the most common cause? Very good. The most common cause would be See, intermittent claudication is a classical sign for arterial obstruction. Intermittent claudication is a classical sign for arterial obstruction. If it was a neurogenic cause, then there would be a constant pain in the patient, not intermittent claudication. याद रख लो, ठीक है? If neurogenic cause होता है, then there is a constant pain. If there is a vascular cause, then there is the intermittent claudication. ठीक है? So intermittent claudication, which further progresses to rest pain, usually more pronounced in the lower limbs as compared to the upper limbs. The most common cause is usually most common cause of gradual arterial obstruction is which is the most earliest or the most common symptom of gradual arterial obstruction. अभी तो बताया, most common symptom of gradual arterial obstruction is intermittent claudication. Most common symptom of gradual arterial obstruction is intermittent claudication. And the most common cause for gradual arterial obstruction is usually atherosclerosis. No issues with this. याद रख लो. This atherosclerosis can occur in any vessels. It can be in the lower limbs, upper limbs, or even in the heart. If it occurs in the heart, then it will cause myocardial infarction. If it occurs in the heart, earlier stages would be angina, and late stages it will cause myocardial infarction. So here you can see atherosclerosis of the coronary vessels. I have shown you earlier also. So what is this investigation? वो investigation के नाम पूछ रहे हैं आजकल. So this is what is the coronary angiography. And you can see obstruction in the vessels. Okay, no issues with this. So most common and earliest symptom of gradual arterial obstruction is intermittent claudication, which will further progress to rest pain. So rest pain कब होता है? In intermittent claudication, there would be decreased blood supply to the lower limbs. But if this blood supply also decreases to the nerves, then there would be a constant pain, and that is what is called as a rest pain. After that, there would be coldness, numbness, paresthesia होंगे, tingling sensations होंगे. After that, it will progress to pre-gangrene. After that, it will lead to critical limb ischemia, and finally, it will cause gangrene in the patient. ठीक है? So directly gangrene पे नहीं जाता है patient, right? So याद रखो, gradual arterial obstruction occurs over a longer duration. No issues with this. What is the investigation of choice? So याद रखो. Very good. Investigation of choice should be non-invasive. ठीक है? जब तक हम we can prefer a non-invasive investigation, we will prefer that. Okay? So if the non-invasive investigation is better, till that time we will prefer it. Agar non-invasive investigation is not available, then we will go for invasive investigation. No issues with this. So here the investigation of choice is a color Doppler. Nowadays we also do a ultrasound B scan along with it, and therefore it is called as a duplex scan. So here we do two things. First is color Doppler. First is, and second is ultrasound B scan. So for any vascular pathology, the investigation of choice would be duplex scanning, or if you have color Doppler in option. Okay? Better answer to be marked as duplex scan followed by color Doppler. कोई दिक्कत नहीं है, याद रखना. Now here, if I perform a color Doppler, I can assess the ABPI. What do we mean by ABPI? Ankle brachial pressure index. This came earlier. Okay, ankle brachial pressure index. That means I will assess the pressure. Maximum systolic blood pressure at the ankle. Whereas maximum systolic blood pressure at the brachial artery. That is what is known as ABPI, ankle brachial pressure index. Normally ABPI कितना होता है? Normal ABPI is 0.9 to 1.3. Normal ABPI is, बोलो तो सही, normal ABPI is why? Because the blood pressure in the lower limbs would be somewhat higher due to gravity, right? So ankle brachial pressure index is equal to maximum systolic blood pressure in the upon maximum systolic blood pressure in the normal ABPI is 0.9 to 1.3. So when do we say if the patient is having intermittent claudication? If the ABPI is less than ABPI is less than 0.5, the patient will start having rest pain. And important question पूछा गया था, when the patient will have critical limb ischemia. So critical limb ischemia is seen less than, and gangrene mein ABPI would be 0.1 only. Okay, in gangrene the ABPI would only be 0.1. No issues with this. Vascular surgery से question आते हैं, don't underestimate it. ठीक है, Buerger disease इसी का question था, ठीक है ना. So important है, at least तुम्हें ABPI पता होना चाहिए, because ABPI पे question आ चुका है. Normal value of ABPI is 0.9 to 1.3. Less than 0.9 is suggestive of intermittent claudication, and critical limb ischemia में value would be less than 0.3. What do we do for treatment in gradual arterial obstruction? Anybody? First of all, we will do lifestyle modification. The first line treatment would be lifestyle modification, reduction of weight, exercise, okay, quitting of smoking, all of these would be done. After that, we will give drugs, and these drugs would be, we will give pentoxyphylline. We can give pentoxyphylline or cilostazol like drugs. ठीक है, we can give pentoxyphylline or cilostazol. क्या हुआ, नहीं पढ़ा ये, पहली बार पढ़ रहे हो, क्या हो रहा है? अच्छा ठीक है, ओके, नो वरीज, ठीक है. We will give drugs like pentoxyphylline or cilostazol, ठीक है. But usually, what is the definitive treatment? Anybody? What is the definitive treatment? Drugs next line होगा. Definitive treatment would be, very good, it would be either PTA, that is percutaneous transluminal angioplasty. What is PTA? Percutaneous transluminal angioplasty. What is PTA? Percutaneous transluminal angioplasty. So it can be of two forms. Either we can do a balloon dilatation, or we can insert a stent, okay. But the best treatment option that we have, anybody? But the best treatment option that we have is artery bypass grafting. Best treatment option is artery bypass grafting. No issues with this. Now if they ask you which is the best autologous graft, auto means from the cell, okay, autologous means from cell. Which is the best autologous graft? Mammary से भी better है. For lower limbs we are using ना. So याद रखना, for other vessels it is usually lima or rima, that is left or right internal mammary artery. It is left or right internal mammary artery. But if we need to do it for usually lower limbs, then we can prefer a vein known as great saphenous vein. Okay, either we will prefer great saphenous vein or which artery? Left and right internal mammary artery. So which are the best autologous grafts? Which vein? Great saphenous vein. And which arteries? Lima or rima बोल दो. Which arteries? And there is a reason why we choose lima and rima, because there is the least chance of atherosclerosis. So if they ask you least chances of atherosclerosis are seen in which artery, answer is lima or internal mammary artery. Best synthetic graft is polytetrafluoroethylene. Best synthetic graft is polytetrafluoroethylene. Whereas most commonly used synthetic graft is Dacron. No issues with this now, anybody? Okay. So the best treatment option would be bypass grafting. Best treatment option is bypass grafting. Okay. Here we can for percutaneous transluminal angioplasty. Okay. Angioplasty के लिए we can use this catheter, and this catheter is known as, anybody? Very good. This is known as a vascular catheter, which has a balloon at its end. This is known as a Fogarty's catheter. ये image आ चुकी है, ठीक है? Foley's की नहीं आई, but ये आ चुकी है. So vascular catheter is known as Fogarty's catheter. It has a three-way and a balloon at its one end. ठीक है? तो याद रखना, this is a Fogarty's vascular catheter, and Fogarty's vascular catheter is used for which surgery? First is percutaneous transluminal angioplasty. transluminal angioplasty. And second, it is also used for embolectomy. Second, it can also be used for, if you need to remove an embolus, you can also do it with the help of Fogarty's catheter. No issues with this. Now, if a patient has atherosclerosis or gradual arterial obstruction, investigation of choice was duplex scanning. But the gold standard is not practical, it is invasive. CT की क्यों जरूरत है? Angiography. The best it would be angiography. Best would be, so CT साथ में कर सकते हो, X-ray कर सकते हो, anything can be done. Okay, but the best or gold standard technique would be, whereas the investigation of choice is duplex scanning. No issues with this, anybody? याद रखना, ठीक है? Treatment समझ गए, कोई दिक्कत नहीं है. Either percutaneous transluminal angioplasty or the best treatment, artery bypass grafting. If a young female presents to me who is a known case of SLE or a known case of scleroderma, okay, a connective tissue disorder है patient में, and now she says on cold water exposure there are some color changes which are seen in her fingers or tips of the fingers. This is what is known as the, and Raynaud's phenomena is due to spasm of arterioles and venous. It is due to spasm of, so both undergo spasm, ठीक है? Arterioles as well as venous. What is the color changes which are seen? First there would be white. WBR is the mnemonic. First change would be, second changes, and third changes. So first is, second is, third is, first is, second is, third is. In which phenomena? Associated with which diseases? Connective tissue diseases. Associated with, more commonly seen in whom? More commonly seen in young females. It is due to spasm of arterioles and venous. No issues with this, anybody? याद रखना. Treatment would be avoid cold water exposure in the patient. Wear warm clothing. Okay, wear warm clothing in the patient. और अगर बहुत ज़्यादा हो जाता, then we will do surgical treatment. Otherwise, only usually by lifestyle modifications only the patient is treated. Or we can give in arterial obstruction also, or in cases of Raynaud's phenomena also. We can also give drugs like, which are vasodilators. Drugs like calcium channel blockers or nitrates. Calcium channel blockers or याद रखना, ठीक है? No issues with this. ये question पूछा जा चुका है. Which drugs are given in Raynaud's disease? So drugs like calcium channel blockers or nitrates can be given for vasodilation. A 35-year-old male smoker presents to you with given complaint. What is the diagnosis? So this was the image that came earlier. What you can see in this fingertips? Gangrene. क्या हुआ है fingertips में? Gangrene. And gangrene is due to decreased blood supply. And decreased blood supply is called as ischemia. Okay. And if there is severe ischemia in the fingertips or in the end arteries, they will further progress to gangrene. Okay, याद रखना. So this is what is gangrene. And what is the diagnosis in this patient? Diagnosis in this patient is, so Buerger's bolo, Buerger's bolo. Diagnosis is, this is the second most common cause for gradual arterial obstruction. This is the second most common cause for gradual arterial obstruction. Buerger's disease is also known as, Buerger's disease is also called as thromboangiitis obliterans. Buerger's disease is also called as thromboangiitis obliterans. So in options, sometimes you will not get Buerger's, you will get thromboangiitis obliterans. By the name itself, it is evident. Thrombo means thrombus, angiitis means inflammation of the vessel, obliterans means the vessel lumen is narrowed down. Okay, so thromboangiitis obliterans. It is due to build-up of atherosclerotic plaque again in the vessels. More commonly, which vessels are affected? Lower limb or upper limb? More commonly, it is the lower limb. In atherosclerosis or in Buerger's disease, more commonly, which vessels are affected? Lower limb. दिखाया ये है, इसका मतलब ये नहीं कि बस upper limb affect होती है, ठीक है? याद रखो. Then, what is the investigation of choice for Buerger's disease? Again, vessels, duplex scan. Investigation of choice is a duplex scan. But gold standard investigation would be, ठीक है? And on angiography in Buerger's disease, which appearance which we will get? Very good. Here you can see a femoral artery, and on gold standard investigation, that is angiography. Which appearance we will get? Corkscrew appearance. Which appearance? Which appearance? So corkscrew appearance or rosary bead appearance on angiography suggests your corkscrew appearance on angiography suggests your corkscrew appearance on angiography suggests your which appearance is seen on angiography in Buerger disease? Corkscrew appearance. Which criteria is there for diagnosis of Buerger disease? Anybody? The criteria is known as Allen's criteria for diagnosis of. ठीक है, तीन चीजें हैं इसमें Allen's criteria में. First, the patient would be a male less than 45 years of age group. Patient would be a male less than. So that means it usually affects which males? Young males. Second, there should be a history of smoking or tobacco use. There should be a history of. And third, there should be signs and symptoms of. Distal ischemia. There should be signs and symptoms of. That means feeble pulse usually or intermittent claudication. All of these features should be seen in the patient. Okay? Then you can diagnose it as Buerger disease or thromboangiitis obliterans. What is the treatment of choice? Anybody? Well, drug of choice. If I talk about treatment, guys, over here. If I talk about treatment, the first line treatment would be lifestyle modification. And here, what lifestyle modification is required? Okay, quit smoking. What lifestyle modification is required? Quit smoking. Along with that, weight reduction, exercise, all of these are recommended. Okay, which drugs are given? Important here. Drugs are pentoxyphylline and cilostazol. Okay, drugs are pentoxyphylline and cilostazol. It will improve the blood flow. Okay, and that is why they will prevent thrombus formation. Okay, that is why the drugs used in Buerger disease are pentoxyphylline and cilostazol. And no issues with this. If the pentoxyphylline, it will prevent thrombus formation. Anticoagulant की तरह काम करती है. ठीक है. Important. ये बता दो. If the patient does not respond to medical therapy, then we can perform a lumbar sympathectomy. In lumbar sympathectomy, we will remove the lumbar ganglia. But if the patient has bilateral disease and all the lumbar ganglia has to be removed, एक lumbar ganglia बचाना पड़ेगा, and that would be L1. Because to prevent impotence in males. Okay, if all lumbar ganglia are removed, that will cause impotence in males. No issues with this. So lumbar sympathectomy is also a treatment option. If the patient even does not respond to this, then either a PTA or bypass grafting. No issues with this. Anybody? Yeah. Nicotine replacement therapy is only given for quitting smoking. Okay. So if the patient is willing himself, he can quit smoking by himself. So no need. If the patient cannot, then nicotine replacement therapy. Next is arterial or vascular aneurysm. Aneurysm means dilatation of the vessel. Most common vessel undergoing aneurysm is rupture of berry aneurysm, circle of Willis. Most common vessel undergoing aneurysm is most common extracranial vessel. If they ask you, अरे ये सब one liners है भाई. Most common extracranial vessel is abdominal aorta. Abdominal aorta is also the most common site for atherosclerosis. And also the most common extracranial site for aneurysm. Most common peripheral vessel, same as atherosclerosis. This was a question. Popliteal artery. Most common peripheral vessel for aneurysm. Most common peripheral vessel for atherosclerosis, popliteal artery again. For atherosclerosis or aneurysm, most common peripheral vessel involved is popliteal artery. ये question आ चुका है पहले, don't make a mistake. Most और recent आ चुका है popliteal वाला तो, ठीक है? देखोगे किसी भी recall questions में बार-बार question मिलेगा. Most common visceral artery involved is, most common visceral artery involved is, most common visceral artery involved is. No issues with this now, anybody? जल्दी से most common vessel, most common extracranial vessel, most common peripheral vessel, most common visceral vessel, most common vessel for atherosclerosis, most common vessel for atherosclerosis, up down वाला होता, most common vessel for atherosclerosis, most common peripheral vessel for atherosclerosis. कोई दिक्कत नहीं है इसमें. What is the investigation of choice? जल्दी बताओ. Investigation of choice for aneurysm, anybody? Investigation of choice would be, डॉप्लर से पता नहीं लगेगा, एओर्टा है वो, बीच में बहुत सारे ऑर्गन्स, सुपरफिशियल ऑर्गन्स अल्ट्रासाउंड दिखाएगा तुम्हें, डीप नहीं. एंजियो इज द इन्वेसिव मेथड, दिख रहा है सामने यार, CT. ओके, so the investigation of choice would be CT scan. Investigation of choice would be, investigation of choice would be CT scan. ठीक है? So yeah, either a CCT can be performed or CT angiography can be performed. A CCT or a CT angiography can be performed. CCT because it is non-invasive. CCT because it is non-invasive. ठीक है? याद रखना, कोई दिक्कत नहीं है. CT angio में again you need to inject a dye. If I perform a CCT abdomen in this patient in aneurysm, I can see with sign. Here you can see with sign is seen. So this is the CCT abdomen of aneurysm. With sign is seen. Are दिख रहा है? Very good. You can see a crescent sign. You can see a crescent sign, also known as with sign. Meniscus and half moon shape को क्या बोलते हो? Either crescent or meniscus. Anywhere you see half moon shape, you will call it as crescent or. So what is the sign in aneurysm? CT sign in aneurysm. CT sign in aneurysm. CT sign in aneurysm. Crescent or meniscus sign. Crescent or meniscus or it is a CT sign for. It is a CT sign for. It is a CT sign for aneurysm. No issues with this, anybody? What is the treatment of surgery? Treatment. Either we can perform a open or endovascular aneurysmal repair. Open or endovascular aneurysmal repair. And which graft can be used? 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 So it can be either open or endovascular repair. It can be either open or endovascular repair. And which graft is used? Which graft is used? No issues with this. क्योंकि aneurysm में बार-बार risk होती है, there would be recurrence. Okay, that is the important. Next question says recall questions. मैं जितने भी questions आ रहा हूँ, all of these are recall questions. अगर ये नहीं आ रहे, then that is a matter to worry. You need to revise it again and again. ठीक है? A patient presents with diffuse chest pain radiating to the interscapular area or to the back. His blood pressure is falling, that is 90 by 50 mm of Hg. That means the patient is going in hypotension or shock. What is the investigation of choice? Classical case, diffuse chest pain radiating to the interscapular area. Aortic dissection. The diagnosis over here is aortic. The diagnosis is aortic. The diagnosis is aortic. Classical case is aortic dissection ka. So in aortic dissection, the pain would be in the chest. Pain would be in the chest, but it will radiate to the interscapular area. It will radiate to the interscapular area because aorta is in the retroperitoneum. It is in the posterior mediastinum. Therefore, the pain radiates to the interscapular area. Or they will say the pain increases on lying supine. So classical case of aortic dissection. Classical case of aortic dissection. No issues with this. Easy hai. If a patient presents to an emergency with aortic dissection. Aortic dissection is what? Alternative pathways created for blood flow. ठीक है? Most common cause would be. Most common causes hypertension. Okay, uncontrolled hypertension can cause tear in the intimal layer. Okay, it can cause tear in the intimal layer and alternative pathways created for blood. That is what is aortic dissection. That is what is aortic dissection. Most common causes uncontrolled hypertension. No issues with this aortic dissection. याद रखो. So if the patient comes to an emergency and he is unstable, investigation of choice would be, अगर patient stable होगा, then investigation of choice is different. If the patient is unstable, like in our case, here the investigation of choice is different. Investigation of choice would be a transesophageal echo. Transesophageal, unstable, investigation of choice, unstable, investigation of choice, unstable patient, investigation of choice, unstable patient, investigation of choice, stable 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 patient, investigation of choice, thorax or abdomen depending on the level. Okay. So here on CECT of CECT with sign is seen. Very good. Tennis ball sign. With sign is seen in aortic dissection. With sign is seen in aortic dissection. With sign is seen in aortic dissection. No issues with this. याद रखना. Aneurysm with sign. Aneurysm with sign. Aneurysm with sign. Aortic dissection with sign. Aortic dissection with sign. टेनिस बॉल का क्वेश्चन आ चुका है ऑलरेडी. ठीक है. नो इश्यूज विद दिस. क्रिसन का नहीं आया, नीट पीजी में था, बट टेनिस बॉल का एफएमजी में आ चुका है. नो इश्यूज विद दिस. स्टेबल इन्वेस्टिगेशन ऑफ चॉइस. स्टेबल पेशेंट इज इन्वेस्टिगेशन ऑफ चॉइसेस. अनस्टेबल पेशेंट है, बीपी इज क्रैशिंग, इन्वेस्टिगेशन ऑफ चॉइसेस. ट्रांसइसोफेजियल इकोकार्डियोग्राफी. ट्रीटमेंट की बात बताओ जल्दी. सो आयोटिक डिसेक्शन कैन बी क्लासिफाइड सर्जिकली एज स्टैनफोर्ड. डीबी की क्लासिफिकेशन भी होता है, बट एटलीस्ट रिमेंबर स्टैनफोर्ड ए एंड स्टैनफोर्ड. Stanford A and Stanford. So Stanford A is in which aorta? Stanford A is in ascending aorta. Stanford A is in Stanford A in A for दोनों में भी हो सकता है, both भी हो सकता है. ठीक है. And Stanford B is in what is the treatment of choice for Stanford A? Treatment of choice for Stanford A. Treatment of choice for Stanford A. Treatment of choice for Stanford A. Whereas treatment of choice for Stanford B is, we will give drugs. Medical management is done. What is done? Medical management. And which drug is given? Beta blocker like esmolol. Beta blocker like esmolol. And then we will monitor the patient. If the patient deteriorates, then we will prefer to surgery. Then we will go for surgery. So ये question आता है. If it is Stanford A, treatment of choices. Stanford A, treatment of choices. Stanford A, treatment of choices. Stanford B, treatment of choices. Medical management. Stanford B, treatment of choices. Medical management is done with esmolol के बाद we do. If the patient deteriorates, then surgery कौन सी होती है? Again open artery repair. And the best graft used, the most common graft used is, the most common graft over here also is Dacron graft. कोई दिक्कत नहीं है. Moving further, embolism. Embolism is usually suggestive of acute arterial obstruction. Embolism is suggestive of acute arterial obstruction. Embolism is suggestive of acute arterial obstruction. What do we mean by embolism? A thrombus was formed, it dislodged from its place and goes and embolizes into other vessel. Okay, that is what is the embolism. There are 5 P's of embolism. Sometimes 6 they describe it as. So what are the 5 P's of embolism? Acute arterial obstruction में क्या होगा? Due to decreased blood supply suddenly, the patient will experience. First would be, then there would be pallor, then there would be pallor. Third there would be, paresthesia, then there would be, that is decreased sensation or numbness. Next there would be poikilothermia. What do we mean by poikilothermia? Coldness. Poikilothermia is, and the last sign to appear is pulselessness. Important question, ये बहुत बार आ चुका है. They mark you at the medial malleolus of foot and they ask you which artery is palpated at this side. posterior tibial artery. Which artery is palpated between the medial and lateral malleolus? Posterior tibial artery. ये question दो बार अभी last 4 exams में repeat हुआ है. Okay, they mark you at the medial malleolus. Which artery can be palpated at medial malleolus? Posterior tibial artery. If they mark you between the first and second metacarpal, metatarsal, dorsalis pedis artery. First and second metatarsal के बीच में dorsalis pedis artery. तो याद रखना, usually arteries are palpated against a bone. Therefore, you can feel that artery better. Which artery? ये question था पहले का. Which artery is difficult to palpate because it does not have a bony prominence? Which artery? Very good. It is the popliteal artery. Which artery is difficult to palpate? Which artery is difficult to palpate? Popliteal artery. The most common artery used to palpate is radial artery. कोई दिक्कत नहीं है इन सब में, याद रखना important. For leg, it is the femoral artery, then the popliteal, and then the posterior tibial artery, and lastly the dorsalis pedis artery. कोई दिक्कत नहीं है, ये question है, याद रखो. And the last P that is, sixth P that is sometimes added is paralysis. Okay, so what are the five P's of embolism? First is, second is, third is, fourth is, and the last is, pulselessness. No issues with this, anybody? Now, embolism investigation of choice would be, again, investigation of choice is a, no issues with this, investigation of choice for gradual arterial obstruction or for embolism, acute arterial obstruction. For both of them, it is duplex scanning. Management की अगर मैं बात करूं, what is the first step in management? To prevent the extension of thrombus. That means the thrombus should not increase in size. We will get subcutaneous, low molecular weight heparin. What is the first step to be given? What is the first step to be given in embolism? What is the first step to be given in embolism? Subcutaneous, low molecular weight heparin. No issues with this. If the patient presents to you within 6 hours of the episode, then the treatment would be either we can do a embolectomy. And embolectomy is done with which catheter? उधर लिखवाया था, Fogarty's catheter. Embolectomy is done with Fogarty's catheter. Or we can do thrombolysis. And thrombolysis is done with recombinant tissue plasminogen activator. Here we will use streptokinase or urokinase. ठीक है, याद रखो. If the patient presents to you in late after 6 hours, or if there is already gangrene, then the treatment of choice would be. Gangrene के लिए treatment of choices. No issues with this, anybody? शाबाश. हाँ बोलो. Overall pulsate करने के लिए radial artery best है. Carotid हम usually नहीं करते. If the peripheral pulses are feeble, then we will go for the carotid artery. ठीक है, no issues with this, anybody? Treatment समझ गए, investigation of choice समझ गए. Moving further, a 45-year-old female took long flight and after landing, ये medicine से भी question important है, ortho से भी. A 45-year-old female took a long flight and after landing complains of chest pain and dies on the way to the hospital. Cause of death and underlying cause is what? So what is the cause of death? Cause of death is massive pulmonary embolism. Cause of death is massive pulmonary embolism. And why this pulmonary embolism occurred? What was the underlying cause? DVT. The underlying cause was deep venous thrombosis. In deep venous thrombosis, which are the most common vessels affected? Anybody? Most common vessels affected in deep venous thrombosis are the calf veins, known as the soleal veins. Calf vein known as the. So most common vessels affected in DVT are. And therefore they would lead to pain and swelling in the calf. So there would be thrombus formation in the deep veins of the lower limbs. And why this thrombus formation occurs? Wahi classical triad of virtues which is responsible for thrombosis. First is hypercoagulability. Second is a slow or altered blood flow or stasis of blood. And third is endothelial injury. Most important is endothelial injury. Important from pathology. ठीक है? So that is the most common cause for deep venous thrombosis. If a patient of deep venous thrombosis has prolonged immobilization, if the patient has prolonged immobilization, then it will cause what? Dislodgement of the clot from the lower veins to the pulmonary vessels, and that will lead to massive pulmonary embolism, leading to chest pain and sudden death of the patient. No issues with this. Most common symptom kya hoga? As I told you, pain and most common symptom would be pain and most common symptom is pain and most common symptom is pain and swelling and in the mainly in the calf. Okay. What are the signs you can elicit? So when you press the calf of this patient, there would be extreme pain. That is known as which sign? That is known as, when you press the calf, there would be pain. This is known as the Moses sign. This is known as the pain on pressing the calf is known as the pain on pressing the calf is known as the, and pain or resistance on dorsiflexion of foot is known as the Homan sign. Pain or resistance on dorsiflexion of foot is known as the pain or resistance on dorsiflexion of foot is known as the Homan sign. No issues with this. So two signs seen in DVT. First is, second is Homan sign. No issues with this, anybody? What is the investigation of choice? Again, it is duplex. Investigation of choices, duplex scanning. Okay, no issues. Gold standard would be angiography. Thrombosis बताएगा ना तुम्हें को. ठीक है? So what is the treatment, anybody? If the patient presents you with massive pulmonary embolism, definitely you need to do thrombolysis in that patient. ठीक है? But if the patient presents to you with DVT only, ठीक है? If a patient of DVT presents to you, तब क्या करोगे? You will give compression stockings to the patient. First of all, you will ask the patient for lifestyle modification, weight reduction, exercise, all of that. But after that, you will ask the patient for using pneumostatic compression stockings. So these are the pneumostatic compression stockings. What can be used? Pneumostatic compression stockings can be used. No issues with this. Pneumostatic compression stockings. Okay, they will not let the blood accumulate at a point. Okay, and that will prevent thrombosis in this patient. So these are the pneumostatic compression stockings. Okay, we can also give only normal compression stockings. ठीक है, तुम्हारे क्या होता है वो? लड़कियां क्या पहनते हैं? Stockings जो भी होता है. That compression stockings can be given. No issues with this. So these are the pneumostatic compression stockings. If the patient presents to an episode of DVT, then what should be done? Coagulation and anticoagulation. So in episode of DVT, you will give low molecular weight heparin. In episode of DVT, you will give low molecular weight heparin. And after usually 5 days, you will start the patient. Low molecular weight heparin is given by which route? Subcutaneous. Therefore, it cannot be given on a long term. Therefore, the other drug which can be given is oral warfarin. The other drug would be oral warfarin. No issues with this. So in episode, which drug would be given? In episode, which drug is given? But after that, which drug is given? Maintenance therapy, warfarin ke sath. Maintenance therapy, and for prevention of thrombus, pneumostatic compression stockings. No issues with this, anybody? Next, a surgeon. Okay, surgeon needs to stand for long hours, 4 to 5 hours, 8 hours of surgery bhi hoti hai. A surgeon who is practicing for the last 15 years complains of dull aching pain and dilated veins as seen in this image. So what are these known as? These dilated tortuous veins are known as varicose veins. These dilated tortuous veins are known as varicose veins. So the diagnosis in this condition is, the risk factor for varicose veins would be DVT, deep venous thrombosis. Second, it can be prolonged standing. Like in this case, a surgeon stands for a long duration. Then it can be obesity. Obesity will increase the pressure in the lower limb, right? So obesity, pregnancy, any abdominal tumor, all of these which will increase the pressure in the lower limbs can cause abnormally dilated and tortuous veins in the lower limbs called as varicose veins. कोई दिक्कत नहीं है? Classification used is known as CAP classification. Classification used for varicose veins is वो पूरा नहीं पूछेंगे क्लासिफिकेशन, बट वो पूछ सकते हैं सी क्या ई क्या. तो सी फॉर क्लिनिकल मैनिफेस्टेशन, सी फॉर ई फॉर एटियोलॉजी, ए फॉर anatomic distribution, A for anatomic distribution, and P for pathophysiology. Jaldi se. C for clinical manifestations, E for etiology, A for anatomic distribution, and P for pathophysiology. CAP classification is used for which condition? Varicose veins. In this varicose veins, they have marked over here. There can also be hyperpigmentation which is seen. ठीक है, hyperpigmentation is seen. Okay, it is more likely seen in cases of varicose veins. No issues with this. Now, if there are varicose veins in a patient, surgeries can be done. Definitely, again, lifestyle modifications would be there. Compression stockings are also a very good thing to be given in cases of varicose veins. But if the patient has recurrent varicose veins, or there is a very large abnormally dilated varicose veins, then surgery is to be done. Okay, and for surgery, what should be done? So varicose veins क्यों होते हैं? Because the pressure from the deep venous system goes into the superficial venous system, and these superficial veins are not in a state to handle that much of pressure. Therefore, they undergo abnormal dilatation. That is what is varicose veins. ठीक है? And that is due to what? Usually between deep and superficial veins there is a valve. But if this valve is absent or incompetent, that causes varicose veins in the patient. ठीक है? So if the valvular incompetence is at the great saphenous vein or the saphenofemoral junction, then which surgery is done? The classical Trendelenburg operation. Which surgery is done? In great saphenous vein and saphenofemoral junction, which surgery? Great saphenous vein and saphenofemoral junction, which surgery? Trendelenburg operation is done for which incompetence? Saphenofemoral junction. Trendelenburg operation is done for which incompetence? Saphenofemoral junction. Here we will do flush ligation. Of the great saphenous vein. Stripping is nowadays not recommended. Stripping अभी नहीं करते हम, ठीक है? याद रखना. Short saphenous vein and saphenopopliteal junction. Here we will do flush ligation of अरे नाम बता दो बस. Short saphenous vein. Perforator incompetence. For perforator incompetence, which surgery is the best one? ये क्वेश्चन आ सकता है. सर्जरी का नाम अलग सा है और ऐसे क्वेश्चन आते हैं. Subfacial endoscopic perforator surgery, SEPS. Okay, which is the surgery for perforator incompetence? Subfacial endoscopic perforator surgery. Which is the best surgery for perforator incompetence? Subfacial endoscopic perforator surgery. That is what is SEPS. Okay, or we can perform the classical perforator surgery. Mid thigh में कौन सा perforator होता है? Hunterian. Okay, mid thigh में it is the Hunterian perforator. Above knee it is the Cockett's perforator. Below knee it is the above knee it is the Dodge perforator. Below knee it is the Boyd's perforator. And at the level of medial malleolus it is the Cockett's perforator. तो नाम तो कम से कम याद रखो, ठीक है? So which are the perforators? Perforators के नाम याद होने चाहिए, important. First is the medial malleolus पे below knee Boyd, below knee above knee mid thigh Hunterian, mid thigh. So these are all the perforators, इनके नाम हैं. And therefore the traditional surgery which was done earlier was known as the Cockett and Dodge surgery. The earlier one was known as Cockett and Dodge surgery. But the best one nowadays is, surgery for perforator incompetence is new modalities that we have. Either we can do a radiofrequency ablation or endovascular laser therapy. ठीक है? No issues with this. This can be done for any one of the incompetence. It is either saphenofemoral, saphenopopliteal or perforator. Then next, these are important images, guys. ये क्या दिख रहा है? Here you can see a superficial ulcer at the level of what? Medial malleolus. At the level of medial malleolus. ठीक है, medial malleolus it is also called as which area? Gaiter's area. This is also known as the so medial malleolus is also known as which area? Gaiter's area. And here which ulcer is common? Venous ulcer. Venous ulcer are superficial or deep? Venous ulcer are superficial. Venous ulcer are, and they are single or multiple? They are single or multiple? These are single or multiple? They are multiple, and they can be due to varicose veins. They can develop due to varicose veins. ठीक है, no issues with this. याद रखना. Next one, here you can see a single ulcer or a multiple ulcer. Single ulcer, deep or superficial? Deep. So this is which ulcer? Arterial ulcer. This one is a arterial ulcer. So arterial ulcer is superficial or deep? Multiple or single? So single deep ulcer is superficial. Multiple superficial ulcers are, then you can see in venous ulcer there would be bone or there would be a pale granulation tissue at the end. But in arterial ulcer there would be a reddish or a blackish granulation tissue at the base. ठीक है, no issues with this. ऐसे differentiate करना है. ये venous ulcer वाली तो image कम से कम 3 बार आ चुकी है. ठीक है, and ये छोटे मोटे topic ऐसे ही छूट जाते हैं. That is the reason you need to include these topics. Next, what is this kind of ulcer known as? So this is a neuropathic ulcer. This ulcer is a neuropathic ulcer. And neuropathic ulcer is usually seen in which condition? Neuropathic ulcer is seen in which condition? Neuropathic ulcer is seen in which condition? Diabetes mellitus. It is usually seen in diabetic mellitus, diabetes neuropathy or diabetic dermopathy. Which is the, what kind of ulcer is this? Heel pe. Heel is the third most common site after ischium sacrum. The third most common site for pressure sore is heel. No issues with this. And lastly, this ulcer came in image. Which is this ulcer? Again at the level of medial malleolus. A gross ulcer having a healthy granulation tissue, everted edges. ठीक है, so everted edges है. Healthy granulation tissue where usually it is a marginal ulcer. Which kind of ulcer is this? Marginal ulcer. And marginal ulcer can lead to squamous cell carcinoma. Marginal ulcer can lead to, so which ulcer is pre-malignant? And marginal ulcer can lead to squamous cell carcinoma. No issues with this. Marginal की image आ चुकी है. What is this condition? ये leg वाली images इनको बड़ी प्यारी है, पता नहीं क्यों. Orange discoloration of skin is called as pretibial myxedema. It is not pretibial myxedema. It is very good. It is usually a complication after varicose veins. It is a complication after varicose veins. क्या क्या दिख रहा है? There would be thin, shiny skin. Along with that, there would be hyperpigmentation or redness. So hyperpigmentation होगा और redness होगा. Okay, thin, shiny skin होगी, and there would be thinning of the leg over here. Okay, loss of fat would be there. Okay, there would be loss of fat. So all of this will give which appearance? Inverted champagne bottle appearance. Which appearance? Inverted champagne bottle appearance. Which appearance? Inverted champagne bottle appearance. And inverted champagne bottle appearance is seen in which condition? Inverted champagne bottle appearance is seen in varicose veins का complication है क्या? It is seen in lipodermatosclerosis. So inverted champagne bottle appearance is seen in inverted champagne bottle appearance is seen in inverted champagne bottle appearance is seen in inverted champagne bottle appearance is seen in. No issues with this. It is a complication of varicose veins. तो अभी स्टार्ट कर दूं, मैं 2 घंटे बाद ब्रेक देने की सोच रहा हूँ. ठीक है, तो 1:30 से 2:30 से 3:30. अभी क्या देखें? हाँ, अभी चाहिए, फिर नेक्स्ट सेशन लंबा होगा. मैं नेक्स्ट सेशन में ब्रेक नहीं दूंगा. फिर सोच लो 2 घंटे के बाद ही ब्रेक लेते. क्या अभी चाहिए, बाद में लोगे आधे घंटे बाद? अभी वाले हाथ ऊपर करो यार. बाद में ठीक है, चलो अभी ले लो. सो वी विल मीट एट 2:10 या 2:15 तक चाहिए. टू लंच ब्रेक. आई टोल्ड यू you can grab your lunch, come over here, eat over here. मुझे कोई दिक्कत नहीं होगी. But I will not waste my time. That's for sure. ठीक है, so grab your lunch and come over here. कोई दिक्कत नहीं. 2:15 we'll start. Right now I just completed. What should I do? But start again. Then important subjects की grant हो गए. Subjects देखो कौन से दिक्कत आ रही है. एक और दो subjects. Major subjects को भी target रखो कि पहले complete करो. ठीक है. And then बहुत बार ऐसा होता है ना कि we think that a subject is not so much important. व्याकरण में आता है और वो subject छूट जाता है. उनका डर लगने लगता है बाद में. माइक्रो को subject उठा लो. माइक्रो का तो मैंने बोला एक रिवीजन तो अच्छे से और हर रोज माइक्रो एंड वोलेटाइल सब्जेक्ट है ना 3 दिन पढ़ने सुबह शाम को तो इजी रहेगा
ये DSM I'm just following your slides DSM अब मैं आपकी स्लाइड्स देख रहा हूं because I feel like that's more than
अभी कर सकते हो तो अभी कोई दिक्कत नहीं है इस पॉइंट पे सेकंड रिवीजन पहली रिवीजन करनी है ना यस सर सेकंड रिवीजन करनी है
इमेजेस माइक्रो इमेज सारी देखिए स्नैप से आपको देखिए
और क्वेश्चन सॉल्व करते हैं हो रहा है हो तो रहा है
इमेजेस का सेशन हो
पूरी इमेजेस का तो डॉक्टर विनायक लेने वाले तो थे बट अब पता नहीं उनकी भी एग्जाम है सो डॉक्टर विनायक मोस्ट लाइकली इज नॉट टेकिंग आई एम नॉट श्योर बट शायद अब तक तो कोई उनकी तरफ से पॉजिटिव फीडबैक तो नहीं आया मुझे इमेज वाला का डाउट दिस टाइम होगा यानी हमने तो कर ही लिया जो भी है पर तो बहुत सारे सब्जेक्ट्स की तो कवर कर ही लिया हमने जितने कुछ बच रहा है वो मैं जो भी फैकल्टी आएगी वो तो इमेजेस कवर करेंगी क्यूआरएस में
रिलेटेड कौन आ रहा है
मधु मैम भाटिया की फैकल्टी 15 इयर्स का एक्सपीरियंस है एंड द बेस्ट फैकल्टी फॉर पीएस तो विवेक सर के जितने नोट्स है शायद उनसे भी ज्यादा नोट्स हो सकते हैं मधु मैम के बट शी इज द बेस्ट फैकल्टी बहुत थरोली पढ़ाते हैं फालतू का मजाक मस्ती नहीं चलता उनका अपने काम से काम बट बहुत प्यारा पढ़ाती है
सर माइक्रो की चैंटिंग का माइस सर से पूछनी पड़ेगी होगी माइक्रो
हां
चैंटिंग होगी कि नहीं होगी माइस सर पूछना पड़ेगा
आपको तो डॉक्टर विकास क्यूआरएस में लेंगे बस
बता रहे थे कल बता रहे थे हमने पूछा था बोले ये ओमकार सर ही लेंगे
कौन में
क्यूआरएस नो नो नॉट माइक्रो सर अदर सब्जेक्ट्स
बाकी सब
माइक्रो तो बोला कि अपने घर की बात है
क्यूआरएस में और डॉक्टर ने सर से बात करी है डॉक्टर प्रियांश का अगर डॉक्टर प्रियांश नहीं आते तो मैं ईएनटी भी उठाऊंगा और मैं बालके भी उठाऊंगा क्यूआरएस में फिर क्योंकि आई हैव लेफ्ट दोस फॉर हिम बट अगर वो नहीं आते हैं तो मुझे उठाने पड़ेंगे मेडिसिन तो यार इंपॉर्टेंट चीजें डिस्कस करेंगे बस मेडिसिन तो शायद क्यूआरएस में तो मैं मेन सब्जेक्ट पे फोकस रखूंगा और लास्ट प्रीवियस ईयर क्वेश्चंस होंगे ना वो टेस्ट जो 30 तारीख का मैंने मोस्ट लाइकली मैं ये फिक्स कर रहा हूं क्योंकि 25 टू 29 की फिजियो की क्लास है
जो रखा है इन्होंने
देखता हूं अभी क्यूआरएस के बाद अगर मुझे टाइम मिल जाता है तो आई पर्सनली लुक इनटू इट अरे वो तो भी अभी तो यार क्या बोलते हैं ना फैकल्टीज के क्वेश्चन भी अभी तो एक दो लोग बैठाए हुए हैं दो तो आर फास्ट ऑलरेडी ना those two people are working पता नहीं क्यों तो भी गलतियां हो रही है आई एम नॉट श्योर व्हाई सो दे आर नॉट मेडिकोस बैठाए हुए ऐसा भी नहीं कि नॉन मेडिकोस है
लाइक दे आर जस्ट सेम इम्पेटिगो पीसीओएस ओएचएसएस सेम जस्ट सर 4 मार्क अगर हुआ है इन कॉम्बिनेशन दे आर लाइक 500 क्वेश्चंस तो ये 500 क्वेश्चन 4 मार्क्स से बोल रहे हैं लाइक इन 1200 क्वेश्चंस प्लस दोस 500 एवरीवन इज एबल टू स्कोर 220 प्लस
सी इसमें क्या करूंगा ना मैं मॉक में अब पता नहीं मैं कितने अलग क्वेश्चन डालता हूं और टाइपिंग तो मेरे से तो होनी नहीं मैं थक गया अब तो इससे करवाऊंगा मैं तो मैं बैठ के इनको क्वेश्चंस देखूंगा मैं अपने बना के जितने मुझे एक्स्ट्रा भेजने वो भेज दूंगा मेरी तरफ से बाकी अपनी तरफ से भेजे मेन एम मेरा वो नहीं है कि मैं तुम्हारे क्या बोलते हैं ना क्वेश्चन सॉल्व करो वो वाले मेरा मेन एम ये होगा कि मैं ज्यादा से ज्यादा पीवाईक्यू के पॉइंट्स कवर करूं पीवाईक्यू आई एम नॉट कवरिंग क्वेश्चंस मुझे क्वेश्चन से मतलब नहीं क्योंकि क्वेश्चंस डायरेक्ट उठ के नहीं आते सो इट इज रिलेटेड तो अगर फॉर एग्जांपल अपन एक फॉर एग्जांपल अगर क्वेश्चन आता है जैसे कि यही समझ लो क्या बोलता है एसोफेजियल अट्रीजिया का है लास्ट टाइम अगर इन्वेस्टिगेशन ऑफ चॉइस पूछा था मैं ट्रीटमेंट भी डिस्कस कर लूंगा साथ साथ इमीडिएटली तो इस तरीके का वो सेशन होगा आई हैव डन इट ऑन डीपीजे जून एग्जाम के लिए जून सेशन के लिए किया था मैंने डीपीजे पे पूरा वन लाइनर्स का सेशन था ऑलमोस्ट 3 घंटे 10 घंटे का था ना
तो वही करा दो सर्कल बोल रहे थे लाइक ज्यादा शॉर्टकट हो गया बच्चे बस शॉर्टकट ही देख रहे हैं
अरे शॉर्टकट तो भी इसीलिए मैं शॉर्टकट अभी इसमें नहीं दे रहा बिकॉज़ लास्ट टाइम व्हाट आई गॉट टू नो वाज कि people are only reading surgery from the chanting notes.
Yes, exactly.
So the problem was कि I thought if I'm taking chanting इसीलिए मैं बढ़ा रहा हूँ मेरा कोई ये नहीं मकसद नहीं है ना मैं को ज्यादा काम करने का शौक है but the only problem is I am only doing this for keep low actually second and third revisions only they are doing it from the chanting notes. तो यार सर्जरी जैसे बड़े सब्जेक्ट के लिए चैंटिंग वुड डेफिनेटली नॉट बी सफिशिएंट लास्ट टाइम की जितनी थी, तो मैंने तो वो बस इंपॉर्टेंट पॉइंट्स कवर किए, बट इस बार फिर आई थॉट कि यार थोड़ी लंबी हो जाए, भले लास्ट टाइम 45 स्लाइड से इस बार 55 है, अगर 10 स्लाइड बढ़ जाए कोई दिक्कत नहीं है, बट एटलीस्ट मोर टॉपिक्स वुड बी कवर्ड, एंड अगर वो इसमें से भी पढ़ रहे हैं इसमें से भी रिवीजन कर रहे हैं कम से कम ढंग से करें, so that is what is my understanding
because it feels like it's covering everything, तो बच्चे यही पढ़ रहे हैं.
हाँ हेलो चाय 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 मत लाइए, है तो फ्रेश हो तो लाइए, फ्रेश हो तो लाइए, बॉटल ना लाइए, नहीं तो फिर तो चाय या कॉफी में से अगर फ्रेश हो तो ले आइए, फ्रेश नहीं हो तो फिर दूसरा बायो क्या
लगा दिया, चिपका दिया, फिर
दिया क्वेश्चन सॉल्व करो, बार बार करो, बीच बीच में
वही रिपीटेटिव कर रहा हूँ, बट देन वही
क्या बोल रहे हैं, क्या बोल रहे हैं, देखो एंजाइम डेफिशिएंसी इज इंपॉर्टेंट है, रेट लिमिटिंग एंजाइम्स इंपॉर्टेंट है, इनहिबिटर्स इंपॉर्टेंट है, इसके अलावा तो क्या ही आता है
वो तो है,
इसके अलावा तो आता ही नहीं कुछ ज्यादा,
सब
ये देखो प्यूरिन पिरिमिडीन्स में ज्यादा, उसमें क्या होगा, तुम्हें साइकिल याद रखनी नहीं है, बिल्कुल पूरी साइकिल याद रखनी भी नहीं, टीसीए रखनी है बस, क्योंकि वो उसमें वो पूछता है कौन सी एंजाइम कहाँ यूज होती है, यहाँ से यहाँ से आने तो कर ही रहा है, 16 को होगा 60 इंपॉर्टेंट चीजें बता दूंगा, पढ़ लो, रिपीट करो, अब इनके ये देखो रिवीजन ही है के लिए, और कुछ नहीं कर सकते तुम,
कल ये मैन्युफैक्चर की हुई है, वो भी किया था, माइक्रो मतलब ये थोड़े वोलेटाइल सब्जेक्ट्स हैं जो भूल जाते हैं, माइक्रो हो गया, बायोकेम हो गया, एनाट हो गया, इसमें कुछ ये नहीं है ना कि हाँ कांसेप्ट बना दिया तो एक बार देख लो, एक बार से बस वही
ओबीजी यार, I'll be covering OBG in QRS, ठीक है, OBG, बायोकेम और क्या था, ENT, ophthalmology, all of these will be covered in QRS from my side. If Dr. Priyansh doesn't come, then biochem and ENT मैं लूंगा, otherwise he will be taking.
21 के बाद
22 के बाद,
22 के बाद एक दिन
23 या 24, मेरा सेशन 23 या 24
ट्राई तो ये कर रहे हैं ना, 28 तक सारा लास्ट
30 को लास्ट
30
को वो तुम्हारा प्रीवियस ईयर क्वेश्चन, क्योंकि 25 to 29 क्लास में तुम बिजी है, तो अखिलेश सर आ रहे हैं नई बैच के लिए,
QRS की डेट क्या बताई?
या 23rd 24th 25th ऐसा कुछ प्लान करो, डॉक्टर ने
सब कुछ
इमेज बेस्ड सेशन में तो पूछा था, बट
यार उनका वो जो ग्रुप है ना,
वो शायद ये भी है, क्या बोलते हैं
ब्रेक वाला जो भी, हाँ उसको डाले हुए हैं,
अभी ये एक्चुअली चल रहा है ना कि शायद वो भी बिजी थे, अभी आईना सीट हुआ, अभी नहीं पीछे है, तो आई लास्ट है, बट पहले से शायद पता नहीं क्या हुआ, कुछ बात हुई नहीं थी अभी, बट अभी ही रोज से बिजी था, नॉट श्योर सो विल बी टेकिंग ऑन।
सब कुछ कब तक खत्म हो जाएगा?
सब कुछ ये देखो, अभी तो अपना तो 16 को लास्ट सेशन है एनाटॉमी का, टुमारो आई विल कंप्लीट सर्जरी, 16 को आई विल कंप्लीट एनाटॉमी इन वन डे सेशन, फिर क्यूआरएस होगा 23 24 25 मैक्सिमम, मेरा एक दिन होगा 23 से 24 को, एंड क्या होगा, हाँ मैंने जो बताया ओबीजी, ऑफ्थाल, ईएनटी, बायोकेम, तो ये यूजुअली 4 सब्जेक्ट्स मैं फोकस कर रहा हूँ, इसके अलावा अगर कुछ लेना हो तो मैं पोल डाल दूंगा एक टेलीग्राम में, तो उसके अकॉर्डिंग डिसाइड कर लेंगे, जिसको सबसे ज्यादा मिलता है तो देखते हैं, और
पोल का टॉपिक है, मतलब हमें तो कुछ लिखने सकते हैं,
अच्छा
वो टिक करने,
अरे वो टिक करने वाला, मैं सब्जेक्ट्स ऑप्शन डाल दूंगा, इन चारों के अलावा 5वां सब्जेक्ट कौन सा चाहिए, क्योंकि 6 करेंगे तो कंप्लीट भी नहीं हो पाते, ढंग से फोकस नहीं हो पाता, तो ईएनटी और ऑप्शन और तो छोड़ गया था, तो वो नहीं होना चाहिए, जितना कर रहे हो उतना ढंग से करें, तो भले ही 4 सब्जेक्ट भी कर लेंगे बट अच्छे से करेंगे, एंड इंपॉर्टेंट 4 है, ईएनटी, ऑफ्थो, ओबीजी, ईएसएम, सर्जरी, मेडिसिन काफी अच्छे से हुआ है इस बार तो कोई गुंजाइश ही नहीं है कि अच्छे से नहीं हुआ, ये तुम अच्छे से पढ़ के जाओगे तो कोई दिक्कत नहीं आने वाली, एटलीस्ट दीस थिंग्स इफ यू रीड 80% भी याद रहता है इसमें से, दैट इज मोर देन
सिर्फ फार्मा के लिए आपको
क्या चैंटिंग अभी ठीक है, रेस्पॉइंट पे आके ना अगर पूरे नोट्स बेटर है पूरे नोट्स पढ़ो, हाईलाइटेड पॉइंट्स पढ़ो अपने नोट्स के। अगर नोट्स नहीं पढ़े जा रहे तो ऑल्टरनेटिव है।
किसमें यूज हो रहा है उतना याद रहता है, बट कौन सा रिसेप्टर है, मतलब साइड इफेक्ट वगैरह, फिर दर्द जैसे क्लिनिकल आता है तो उसमें साइड इफेक्ट वगैरह याद करते हैं।
ये देखो सबका इंपॉर्टेंट नहीं है याद रखना, इंपॉर्टेंट टॉपिक्स है कुछ। ये देखो जैसे गाउट हो गया इंपॉर्टेंट है, माइग्रेन हो गया इंपॉर्टेंट है, टीबी हो गया इंपॉर्टेंट है, ठीक है। फिर एंटीबायोटिक्स में और क्या ही है, कोलेरा के मतलब टेट्रासाइक्लिन ग्रुप, टेट्रासाइक्लिन इज इंपॉर्टेंट। अमाइनोग्लाइकोसाइड के तो रटे हुए हैं, नेफ्रोटॉक्सिसिटी नॉटोटॉक्सिसिटी साइड इफेक्ट, तो उसमें कोई दिक्कत नहीं है। लैम्ब इज इंपॉर्टेंट, वो इनकी वजह से कोविड म्यूकर की वजह से थोड़ा, तो वो नेफ्रोटॉक्सिसिटी पे क्वेश्चन आया था अभी, आईएनएसईटी में भी आया था लास्ट, तो वो एंटीबायोटिक्स में उसके अलावा तो है नहीं कुछ। फिर इधर आएंगे तो जनरल फार्मा में तो यार वो कर्व्स है इंपॉर्टेंट, उसके अलावा तो लिटरली कुछ नहीं है। कर्व्स के अलावा काइनेटिक्स है बस, कर्व्स और काइनेटिक्स। काइनेटिक्स पे भी रेयरली क्वेश्चन आता है आजकल तो। एएनएस में तो इंपॉर्टेंट ड्रग ऑफ चॉइस याद रखो बस, ग्रुप और ड्रग ऑफ चॉइस तुम्हें पता होना चाहिए बस, दैट्स इट। वो ये नहीं पूछेंगे कि कौन सा क्या कहाँ क्या मैकेनिज्म पूछेंगे। बेंजोडाइजेपिन्स दैट ड्रग्स ये तो पता ही है तुम्हें वैसे भी। उसके अलावा साइकोटिक्स यार, एंटीसाइकोटिक्स इंपॉर्टेंट है अभी भी। हाँ, एपिलेप्सी तो इंपॉर्टेंट है। ये देखो एपिलेप्सी एंड साइकोटिक्स, तुम बाकी बेंजोडाइजेपिन्स भी छोड़ दोगे मुझे चलेगा, बट एपिलेप्सी एंड साइकोटिक्स तो इंपॉर्टेंट। क्यों? क्योंकि मेडिसिन से भी आएगा, साइकियाट्री से भी आएगा, और साइकियाट्री से इस बार आया था आईएनएसईटी में सबसे इजी क्वेश्चन। साइकी के तो मुझे बहुत इजी क्वेश्चन लगे। एक क्वेश्चन क्या था, a patient who was started on risperidone therapy now presents with spasm of like neck muscles, and what is the drug of choice? So risperidone दो atypical है but maximum EPS उसी से होता है। तो acute dystonia का था, drug of choice benzoxazole नहीं था, promethazine था ऑप्शन। ये क्वेश्चन नीट में भी आया था, ये क्वेश्चन पहले एफएमजी में भी आ चुका है। बहुत कॉमन ऐसे इजी क्वेश्चन आते हैं।
most potent
fastest shortest acting remedy।
सर्जरी की जो फाइल है वो है अभी आपके पास?
किसकी?
कल जो सर्जरी का चैंटिंग नोट
इसी में होगा,
इसी में ही है आज में।
मेरे पास भी है, मुझे मैसेज कर दो कोई टेलीग्राम में व्हाट्सएप पे, आई सेंड
मैं
इट।
व्हाट्सएप कर देती हूँ।
मुझे ये पूछना था कि सारा सब्जेक्ट हो जाएगा, बट मेडिसिन का जो सीरियस है उसमें सर थोड़ा मतलब आज याद रहता है, फिर इतने सारे सब्जेक्ट देखना पड़ता है, तो सीरियस का सर पता है कि हमसे देखना पड़ता है ईसीजी वगैरह। मैंने फिर अचानक से जूम करके इमेज देखता हूँ, हाँ ठीक है, पर अचानक से इतनी बड़ी इमेज आ जाती है।
वो मैंने इतनी बड़ी सीरीज डाली थी ना इस बार, मैंने वो स्ट्रिप डालते यूजुअली टीचर स्ट्रिप नहीं आती यार एग्जाम में, बहुत रेयरली स्ट्रिप देते बस रीड टू, नहीं तो पूरा का पूरा देते और वही कंफ्यूजन होता है। ऐसा तो कोई भी डायग्नोस कर देगा यार, इसीलिए मैंने इस बार जो इस बार इसीलिए मैंने जो डाले ना ईसीजी वाले इमेजेस वो बड़े बड़े डाले पूरे 12 रीड वाले, क्योंकि इंपॉर्टेंट वही है, तुम वहां पे सीखो डायग्नोसिस करना, कौन सी रीड्स देखनी है कौन सी।
एक बार वो सीरीज का बस इंपॉर्टेंट आपको लगता है कि हां ये आ सकता है,
लास्ट में वो जो पीवाईक्यू वाला होगा ना, तो उसमें पीवाईक्यू ईसीजी जितने भी थे ना वो डाल दूंगा। एट्रियल से आ चुका है, वी से आ चुका है, वीटी आ चुका है, फिर डब्ल्यूपीडब्ल्यू आ चुका है, साइनस टैकी आ चुका है, ब्रैडी टैकी मतलब वो तुम्हारा 6 साइनस सिंड्रोम आ चुका है, और क्या एमआई आ चुके हैं भाई, वॉल मतलब वो वॉल पूछते कौन सी वॉल क्या एमआई, हार्ट ब्लॉक आ चुका है, सब कुछ तो आ ही चुका है वैसे, बट डिस्कस किया होगा तो
मुझे इसका जेरोक्स लेके फाइल बनवाना है, तो सोचा एक साथ में कर लूं।
अच्छा शॉर्ट सब्जेक्ट में आप किस पे ज्यादा कंसंट्रेट करना है, मतलब एक बार हो गया
जो तुम्हारे वीक है सबसे बेहतर बात ये है। इसके अलावा फॉरेंसिक मेडिसिन, फर्स्ट इज फॉरेंसिक मेडिसिन, पेपर 1 में एक ही शॉर्ट सब्जेक्ट है और इम्पोर्टेंट है। फिर इसके अलावा तुम्हारा ये पेपर 2 से यार एनेस्थीसिया इमेजेस वगैरह, क्योंकि वो हो जाता है सॉल्व एनेस्थीसिया, और उसके अलावा तुम्हारा साइकी, अगर साइकी कर सकते हो साइकी का ऑल्टरनेटिव है ऑर्थो, ऑर्थो भी नहीं कर सकते तो डर्मा।
नहीं सर ऑर्थो डर्मा कर लिए सर, पीडीएफ में है कि मैं इंपॉर्टेंट टॉपिक्स लिखने वाला हूं, जैसे क्वेश्चन कर वगैरह हो गया, माइलस्टोन तो पता नहीं होगा ही, देखना पड़ता है।
ये देखो इंपॉर्टेंट वाले याद कर लो, हर एक रखने का कोई मतलब नहीं बनता है। मैं वो तो वो माइलस्टोन्स का फंडा ही नहीं समझ में आता, इंपॉर्टेंट वाले पूछेंगे, सोशल स्माइल हो गया, स्ट्रिंगर एंजाइटी हो गया, वेव्स बाय बाय हो गया, पिंसर ग्रास्प हो गया, फिर तुम्हारा ब्लॉक्स हो गए, ब्लॉक्स वाला याद होना चाहिए, फिगर्स हो गए, ट्रायंगल स्क्वायर स्क्वायर, ट्रायंगल स्क्वायर सर्कल, ट्राइसिकल हो गया, फिर ड्रेसिंग अनड्रेसिंग हो गया। स्टेयर्स यूजुअली मोर लाइकली नहीं पूछेंगे, अगर पूछते भी है तो वो 4 इयर्स वाला ही पूछेंगे। फिर हॉपिंग एंड स्किपिंग वाला हो गया बस। इसके अलावा हाँ वेव बाय बाय वेव, वो पीकबू वाला हो गया, वो क्वेश्चन आ चुका है। तो ये वाले आते हैं।
पिछली बार ये धोखा हो गया ना कि इमेज को ऐसे करके किए पर वहां डिस्क्राइब करने लगते हैं, हर इमेज को डिस्क्राइब।
मैं तुम्हें वही बोलता हूँ, इसीलिए मैंने स्नैप्स में भी नीचे एक्सप्लेनेशन दिया हुआ है। आई हैव नॉट डायरेक्टली रिटन ये साइन क्या है,
वो तो हम सर कैसे तुम्हें याद कर
देखो
लेते हैं।
तो इजी है। अब बैटर साइन मुझे लगा ही नहीं कि इतना हार्ड था, वो कितना ये होना चाहिए। हाँ तो थोड़ा बहुत कंफ्यूजिंग डेफिनेटली था अग्रसेंगर जो सोच रहे होंगे तो, बट ठीक है यार, ऐसे क्वेश्चंस तो आते हैं। इसीलिए जब भी अभी पढ़ोगे ना तो मेरी अभी भी आदत है, तो मेरे को याद है ये चीज, मैं अभी भी अगर लाइकोडार्माटोस्क्लेरोसिस बोलूंगा तो आई मेक श्योर आई रिपीट दिस इन्वर्टेड शैंपेन मॉडल एवरी टाइम आई रिपीट।